Good morning. This is Dr. Carol Rizer, and I'll be giving you a lecture on nutrition from the Seidel text. It is chapter 6. Nutrition, as we know, is the science of food as it relates to optimal health and performance. Let's look at the physical exam preview first. And the nutritional assessment includes the analysis of a person's nutritional intake and relates it to the findings from the H&P as well as from the anthropometric and biochemical measurements. Now, the CDC defines anthropometry as the science that defines physical measurement of a person's size, form, and functional capacities. Now, it can relate to occupational injury prevention, but for the purposes of this course, we're going to recognize its importance for measuring growth. And it would naturally be dependent on a sequence of endocrine, genetic, constitutional, environmental, and nutritional influences to influence growth. This is discussed in further detail in Chapter 5 of your Seidel text. So a preview of the nutrition assessment would include things like recent growth, weight loss or weight gain, chronic illnesses affecting the nutritional status or intake, medication and supplement use, nutrition screen, assessment of nutrient intake, clinical signs or symptoms of nutrient or energy deficiency, and an assessment of pertinent lab values. The anthropometric measurements that are important in a nutritional assessment would include the items that you see in this list: standing height, weight, BMI, waist circumference, waist-hip ratio, and also a triceps skin fold thickness and a mid-upper arm circumference measurement. We talked about the height and weight measurements in the lecture on exam and equipment, and we'll talk about each one in greater detail a little later in this lecture. The anatomy and physiology of nutrition. Food nourishes the body by supplying nutrients and calories to function in three ways. It provides energy for activities, it provides for building and maintaining body tissue, and it regulates body processes. The nutrients necessary to the body are classified as the macronutrients, of which there are three that we'll talk about, the micronutrients, of which there are very many, and of course water. The word macronutrient refers to nutrients that are required in large amounts, such as carbohydrates, proteins, and fats. Now, these are the big three, and they provide the daily calories needed to produce energy. Now, as a side note, alcohol also does provide calories, but it's not required for any physiologic process in the body, so we're not going to talk about it for this chapter. Carbohydrates, which are mostly found in plants and in milk, are considered the body's main energy source, with about 365 grams stored as glycogen in the liver and muscle, and providing energy for about 13 hours of moderate activity. If energy levels are adequate, excess carbohydrate is stored as fat. Nutritional recommendations that are 50% of total calories are that 50% of the body's total calories come from carbs and in amounts not less than 100 grams per day. So 50% of total calories and no less than 100 grams consumed per day of carbohydrate. In the liver, carbohydrates serve to spare protein for energy and also participate in certain metabolic detoxification duties. Carbohydrates are the only source of energy available to the brain. Glycogen is also stored in cardiac muscle. Now, to touch on the importance of protein in nutrition. It is present in all animal and plant products, and it is essential to life and constitutes more than half the organic matter in the human body. 20 amino acids combine to form proteins. 9 of these are considered essential since they are not manufactured by the body. The main functions of protein are to build and maintain body tissues, regulate internal water and acid-base balance, as well as acting as precursors for enzymes, antibodies, and some hormones. Excess protein may be used for energy, or if not, it will be stored as fat. The recommended dietary protein content is 13 grams for infants, 25 for children, and 45 for adults. Protein should be 14 to 20% of the total calories. Fat is the main source of linoleic acid, which is omega-7 fatty acid, and alpha-linolenic acid, which is omega-3 fatty acid. And both of these fatty acids are essential for normal growth and development. Some other major functions of fat include synthesis and regulation of hormones, the maintenance of tissue structure, nerve impulse transmission, memory, energy metabolism. And again, if more fat is eaten than is needed by the body, it will be stored as fat. Fat is also used as a reserve fuel source when calorie intake is inadequate. And that's what happens to our fat stores when we limit our calories intentionally if we want to decrease our BMI or lose weight. Fat also supports and protects organs from injury and prevents body surface heat loss. Fat should constitute 25 to 35% of the total calories, or at least 20 to 35 grams per day. Okay, so now that we've discussed the big three, let's take a look at some of the micronutrients. These are nutrients that are stored in very small quantities by the body. Some of these include vitamins, minerals, and electrolytes. They are not used for energy, but are essential to growth and development, as well as they are essential to hundreds of metabolic processes. Vitamins and minerals must be taken in either through food or by supplement. And micronutrients cannot be metabolized with the exception of vitamin K, biotin, vitamin D, and niacin. So vitamins and minerals and most micronutrients must be taken in. Water is the most vital nutrient for our bodies, and our adult bodies are about 55 to 65% water. Water provides tissue turgor, alters the configuration of substances for metabolic processes. It transports nutrients and waste products, and it maintains a stable body temperature. As you probably know, there's a continual loss of body water through the kidneys, the lungs, and the skin. About 2 to 2.5 liters of water are lost daily. This loss is replaced by the fluids that we take in, the water in the solid food we eat, and water is also produced by oxidative processes in the body. A day's total energy expenditure includes the energy used at rest, during physical activity, and as a result of thermogenesis, which is the metabolic response to food intake. Resting energy expenditure represents the energy expended by a person at rest under stable temperature conditions and contributes the largest portion of total energy expenditure by the body. Although basal metabolic rate is defined as the resting energy expenditure measured soon after awakening in the morning and 12 hours after the last meal, these two values are often interchangeable since their variability is less than 10%. With resting energy expenditure being the largest proportion of total energy expenditure, Physical activity is the second largest. The estimated energy requirement refers to the average dietary energy intake necessary to maintain energy balance in a healthy individual. The energy expended by certain activities varies, of course. Now, don't I wish that I could burn the same number of calories sitting here at my desk as I do when I go to the gym? I wish. Also, a heavier person will expend more energy for a given task than a lighter person. This makes calculating the EER, or estimated energy requirement, problematic and time-consuming. Look at Table 6-1 in your text, and you will see some equations for predicting REE from body weight. Thermogenesis comes in last in the energy expenditure race, accounting for only about 7% of the total daily energy expended. Now, moving on, let's look at a review of the patient's history and how it relates in attempting to focus the nutritional assessment. In the HPI, or history of present illness, several items should be considered. First, look at the patient's weight. Have they gained or lost weight recently? If so, was it intentional, or during what time period did that occur? If there was weight loss and it was unintentional, are there any associated symptoms? Does the patient seem to have a preoccupation with body weight or shape? What kinds of medications is the patient taking, and how might they influence the weight change? Has there been a change in lifestyle that might have influenced the social aspects of eating? For example, eating more meals at restaurants, more fast food, or between meal snacking. Any changes in the activity level or stresses. And again, consider medications such as steroids, oral contraceptives, antidepressants, and insulin if there has been weight gain. Are there any increased metabolic demands noted, such as fever, infection, burns, trauma, pregnancy, infancy, hyperthyroidism, or cancer? External energy loss can also occur with wounds, fistulas, abscesses, chronic blood loss, and dialysis. Now, with past medical history, ask about chronic illnesses, many of which could influence body habitus. Whether there have been any past efforts to gain or lose weight. What was their weight at 25 years of age? What was the maximum and minimum adult body weights for the patient? Has there been a previously diagnosed eating disorder or a diagnosis of hypoglycemia? And when you interview the patient about their family history, ask about obesity or dyslipidemia in the family. Also, ask about the stature of parents and grandparents, whether any of them had genetic or metabolic disorders such as diabetes, any eating disorders like anorexia or bulimia, and whether there is any history of alcoholism in the family. The personal and social history interview should include the patient's own nutrition, their use of vitamins, minerals, and supplements. What is their usual weight and height? Compare that to the current weight and height. Do they use alcohol? What about recreational drugs? Does their income enable them to purchase nutritional food in adequate amounts? Are they able to shop and prepare their own meals? What is a typical mealtime situation like in their home? Do they utilize supplements of any kind? Are they on tube feedings or parenteral nutrition? What about their dentition? Are they able to chew the food? Ask them about dentures, missing teeth, and/or gum disease. With infants and children, ask about breastfeeding frequency and duration, the type and amount of infant formula, how it's prepared, and the time it takes for the infant to drink when feeding. What is the calorie, protein, vitamin, and mineral intake? Is it adequate? Cystic fibrosis, phenylketonuria, maple syrup urine disease, inborn errors of carbohydrate metabolism, amino acid and fatty acid oxidation disorders, tyrosinemia, homocystinuria, and Prader-Willi syndrome are chronic illnesses that should be questioned. Congenital anomalies such as cleft palate, prematurity, neurologic disorders, tongue thrust, severe congenital heart defect should also be considered. For adolescents, ask about the intake of protein, calories, vitamins, and minerals. Is it adequate for growth? Have they been on any fad diets or supplements? Do they have a preoccupation with weight? And this is not just limited to girls. Are they overly concerned with developing muscle mass or losing body fat? Is there excessive exercise or other obsessive type behaviors like weighing themselves every day, boasting about weight loss or weight goals? Are they leaving foods out of their diet for any particular reason? With pregnant women, determine the pre-pregnant weight. Consider their age, eating patterns, and any eating disorders. What has been the weight gain and nutrient intake during the pregnancy? Explain potential risks like pica, the use of alcohol, and inadequate weight gain. Do they plan to breastfeed? Talk about the nutritional considerations during lactation. Also discuss the influence of any chronic disorder like diabetes, hypertension, and renal disease. In older adults, pay close attention to any weight gain or loss. Evaluate the financial status, their interest in meals, and how many times a day they eat. What is the energy level like? Do they exercise regularly? And again, discuss relevant chronic diseases as well as food and medication interactions. For example, a high intake of grapefruit juice can increase the bioavailability of a statin, and this could cause an increased risk of myopathy. And of course, always include a discussion of over-the-counter medicines. Okay, now let's move on to the physical exam. Some equipment you will need for the nutritional assessment includes a tape measure, a calculator, and a standing platform scale with height attachments. As for the anthropometrics, or measurements of the human body, you should include height, weight, triceps skin fold thickness measurement, and compare the results to a table of norms for relevant age and gender. Body mass index, or BMI, can be calculated using a simple formula. This is used to assess nutritional status and body fat. The waist circumference measurements may aid in predicting risk for cardiovascular and obesity-related diseases over time. A large waist circumference is often associated with an increased risk for diabetes, dyslipidemia, hypertension, and heart disease. A waist to hip circumference ratio can be measured, but it's not usually as helpful as the BMI in assessing total body fat. A higher proportion of fat in the trunk and abdomen is associated with a higher risk of obesity-related diseases than a body that has a larger proportion of gluteal fat. A history of food intake can allow a good estimation of the adequacy of the diet. Ask the patient to recall his food intake over the last 24 hours. Or you could ask them to keep a food diary. Even though this method is most accurate, it's also quite time-consuming. A history of food, complete a nutrient analysis by using a method of diet, history, and recall. Several nutrition screening forms are available to obtain specific information about current nutrition status and intake. Look on the Evolve website or just Google My Pyramid Food Guide for the quickest method of estimating dietary adequacy with reasonable accuracy. The questions can be modified also for infants, children, older adults, or particular circumstances. The My Pyramid Food Guide provides food-based guidance to help implement recommendations for adequate nutrition. It does not, however, deal with infant feeding. explain that no single food group provides all essential nutrients and that variety is the key and that the patient should be utilizing all food groups. Now for those vegetarian diets, variety is also essential, but good and complete nutrition can be achieved with this diet. 5 nutrients may, however, tend to be deficient. They include protein, calcium, iron, B12, and vitamin D. Food guide pyramids for ethnic populations are also available. I'd like for you to review the tables 6-3, 6-5, and 6-6 in your textbook to review functions, metabolism, utilization, deficiency and toxicity signs and symptoms, and food sources of fat and water-soluble vitamins and minerals, and the clinical findings associated with nutrient deficiencies. The measurement of skin fold or fat fold thickness provides another parameter to evaluate the nutritional status of your patient. The jaws of the skin fold thickness calipers must be correctly placed to get an accurate reading. Approximately 50% of the body's fat is present in the subq layer, and a correlation does exist between the triceps skin fold thickness and the body's fat content. You should use the mid-upper arm circumference to estimate the muscle mass and available fat and protein stores. The mid-arm muscle circumference divided by the mid-arm muscle area is a sensitive index of body protein reserves. Both of these measures are commonly decreased in the presence of protein malnutrition. Biochemical measurements often provide further information when assessing nutritional adequacy. And finally, let's briefly discuss some abnormalities you might come across during your nutritional assessment of the patient. Obesity is, of course, an excessive proportion of total body fat. It can be associated with genetic, behavioral, or environmental factors, but it's always a result of an imbalance of caloric intake and energy expenditure. Obesity disproportionately affects some racial groups and those of low socioeconomic status. Body fat, especially the visceral fat, increases the risk for type 2 diabetes, cardiovascular disease, dyslipidemia, and cancer. Medications and certain disease processes may cause weight gain and contribute to obesity. Anorexia is also a psychiatric disease and is characterized by low body weight and body image distortion. Its cause is unknown, but genetic, environmental, and sociocultural factors likely contribute to its development. Female adolescents and young adult women are most commonly affected, but it does also occur in boys and men. There are 2 types, those that limit the intake of food and those that vomit or purge what they eat. Bulimia is also a psychiatric disease in which the cause is unknown. It also affects mainly female adolescents and young adult women. There are also purging and non-purging types, followed by fasting or excessive exercising. Anemia, particularly due to iron deficiency, is another common abnormality of nutritional disorders. Other nutritional deficiencies can include deficient B12 and folate. And that concludes this lecture on nutrition. I thank you for your attention.